If you're listening to this podcast on YouTube, for a better experience, switch to the video version. The link is in the top right corner of the video and in the episode description. Hello and welcome, I'm Fernando, a GP in the UK. Today we're going to talk about ADHD treatment options, especially in adults, always focusing on what is relevant in primary care only. I have based this episode on a number of published medical articles. The links to them are in the episode description. Right, let's jump into it. Modern guidelines emphasize that ADHD management is multimodal, including psychoeducation, environmental adaptations, psychological interventions, and well-indicated medication. For children and adolescents, NICE and other guidelines recommend starting with psychoeducation and behavioral or parent training, then adding medication where impairment remains significant. However, for adults, guidelines are very clear. Medication is usually first line when symptoms cause persistent, moderate to severe impairment, supported by psychoeducation and practical help. So, when is medication indicated? For children and adolescents, medication, usually methylphenidate, is recommended only when ADHD is clearly diagnosed, the impairment is significant, and non-drug approaches aren't enough. In other words, is reserved for moderate to severe ADHD, rather than mild cases. However, for adults, medication is indicated when there is a clear diagnosis of ADHD, with symptoms present since childhood, even if they were never recognized at the time. The symptoms must be causing significant impairment, and other conditions like depression, bipolar disorder, or substance misuse shouldn't fully explain what's going on. And finally, the person needs to want to try medication after discussing the risks and benefits. Guidelines such as NICE and the European Consensus explicitly state that in adults, medication is the main evidence-based treatment for core ADHD symptoms, offered alongside education and support. Which medications should be used and how effective are they? There are two main classes. First, stimulants such as methylphenidate in its various modified release forms, and amphetamine formulations like lisdexamfetamine. Second, non-stimulants including atomoxetine, guanfacine, which has more evidence in children and adolescents, and others like bupropion, clonidine, and viloxazine, though adult data for these are more limited. A major meta-analysis of randomized trials found that in adults, amphetamines produced the largest improvement. They were at least as well tolerated as methylphenidate and more effective than atomoxetine and modafinil. A recent BMJ umbrella review, which examined multiple meta-analyses, concluded that, in the short term, up to about 12 weeks, both stimulants and some non-stimulants produce medium to large reductions in symptoms. Evidence beyond 1 year is more limited, but it does not suggest a loss of effect. The World Federation of ADHD Consensus summarizes this by stating that ADHD medication is clearly effective for reducing symptoms, and that stimulants are more effective than non-stimulants. Are there any long-term benefits of regular medication use? Well, in terms of symptom control, longitudinal studies and reviews show that continued medication is associated with sustained improvements in symptoms and functioning in both children and adults, as well as improvements in overall life satisfaction. Furthermore, there's also evidence for broader life outcomes. The World Federation of ADHD Consensus concluded that drug treatment is linked to substantial reduction in a range of adverse outcomes, including transport accidents, substance misuse and cigarette smoking, educational underachievement, depression and suicide attempts, and even criminal behavior and teenage pregnancy. Taken together, this suggests that for many patients, long-term use of ADHD medication does more than just reduce symptoms. It appears to lower the risk of serious negative life events and improve quality of life. And now let's touch briefly on non-drug treatments. For children and adolescents, guidelines emphasize psychoeducation and parent training programs, school-based interventions, and behavioral approaches such as reward systems and structured routines. For adults, the main non-drug options include psychoeducation about ADHD, CBT tailored to ADHD, that is focusing on time management, planning, and emotional regulation, and finally, coaching and skills training, along with workplace or academic adaptations. So how effective are these approaches? A systematic review of non-pharmacological interventions in adults found that particular CBT and skills training produced small to moderate improvements in symptoms and functioning. However, the World Federation consensus is quite blunt. Non-medication treatments are generally less effective than medication for core ADHD symptoms, although they remain very useful for addressing residual difficulties once medication has been optimized. Now that we know the benefits of treatment, what are the possible side effects and how do we monitor treatment? Common side effects of both stimulants and atomoxetine include reduced appetite and weight loss, sleep disturbances, mild increases in heart rate and blood pressure, headache, dry mouth, gastrointestinal symptoms, and occasionally irritability or mood lability. There are also possible psychiatric adverse effects. Rarely, stimulants and atomoxetine can precipitate anxiety, irritability, mood elevation, or even psychotic symptoms, particularly in vulnerable people or at high doses. To reduce this risk, guidelines recommend careful monitoring, dose adjustments, and stopping the medication if significant symptoms appear. Overall, the World Federation consensus concludes that the adverse effects of medications for ADHD are generally mild and can be addressed by changing the dose or the medication, while the consequences of untreated ADHD are often serious and long-lasting. In terms of cardiovascular safety, for most people without pre-existing heart disease, stimulants and atomoxetine cause only small increases in blood pressure and heart rate, and serious cardiovascular events are rare. So what does this mean in practice? Guidelines recommend taking a brief cardiac and family history, checking blood pressure and pulse, and making sure that there are no red flags before starting medication. If someone has a known heart condition or if the assessment raises any concerns, then we should get cardiology input before prescribing. Regarding misuse, diversion, and dependency, we need to be aware that stimulants have abuse potential, particularly in fast-acting formulations, which is why long-acting preparations and careful monitoring are recommended. However, the consensus statement notes that while stimulants can be diverted or misused, therapeutic doses in people with ADHD are actually associated with lower rates of substance misuse disorders, not higher. In summary, for adults with significant ADHD, medication is the most effective treatment for core symptoms. When used long-term with proper monitoring, it is associated not only with better concentration, but with lower rates of other serious negative outcomes. At the same time, side effects are common, but usually mild and manageable. So that is it, a review of ADHD treatment options. We have come to the end of this episode. Remember that this is not medical advice, but only my summary and my interpretation of the guidelines. You must always use your clinical judgment. Thank you for listening, and goodbye.